I'm Dr. Dave Armstrong. I'm a low vision optometrist in Virginia. Like you, I've Googled Stargardt disease. I wanted to find out what the various websites have to say about what can be done for people with Stargardt who want help now. Most of the websites offer no help for people with Stargardt disease. One website did recommend wearing UV blocking sunglasses and obtaining low vision aids. There was no explanation of what low vision aids are or how to obtain them. I'm a low vision optometrist with experience in helping people with Stargardt disease see better. I'd like to explain to you what low vision aids are, how they help, and how we can tell if they will help you. Stargardt affects young people, usually before age 20. They may be in school, or perhaps they have a job, maybe they're raising a family. When their vision begins to decrease, it can cause trouble reading, seeing the chalkboard in school, doing the vision demands of their job. If they lose the ability to drive, then they can't get to work or take their children to after-school activities. The vision impairment makes their life very challenging. They may have to give up activities that are very important to them. Consulting a low vision optometrist like me can be life-changing. The most common requests that my Stargardt patients make is that I help them with reading, using a computer, driving, or other distance activities. Let me explain some of the types of low vision glasses that can be helpful to people with Stargardt disease. There are many ways of helping people with Stargardt disease see better for reading. I want to show you a few examples of the more common ones that I prescribe. These are called Prismatic glasses, and they magnify what is seen, allowing the person to hold their reading close, see it larger, making it easier to read. These are best suited for people who don't have a really severe vision loss. Another type of glasses that I often prescribe are these telescopic glasses. These are interesting because the telescopes flip up out of the way, but for reading, we modify the telescope, adding an additional lens to the front of each telescope. That makes it focus at the distance that the person would hold their reading. And unlike the prismatic pair that I just showed you, this would focus a little farther away from the person's face, and that can make it more comfortable and easier to deal with their reading. This is a very nice way to deal with reading by using different lenses, additional lenses that can be allowed to focus farther away, which might be helpful for a computer as well. A third type that I often prescribe are called reading telescopes, and they look like this. These telescopes focus at various distances, 13 inches, 15 inches, 17 inches, depending on the person's needs. That's where they hold their reading. They get the additional help of the magnification in these telescopes. So these are very helpful as well for someone who does a lot of reading and perhaps for their job. Another way of helping someone who uses a computer is to use wide-angle telescopic glasses like this. This gives a large field of view, so you're able to see more of the screen. And like the other telescope that I showed you, we modify the telescope by adding an additional lens, of course, to both sides, that would make it focus at the distance of the computer. And that works well for many people for using a computer for their work and things of that sort. There are modifications of all of these things. I'm simplifying this just to show you that there's a lot of ways of helping people see better for these various tasks. Driving is so important to so many people. Unfortunately, sometimes people with Stargardt disease have to give up driving. They can no longer meet the vision requirements. Luckily, many states have different vision requirements, allowing people to drive with telescopic glasses like these. These are called Bioptic telescopes. The person's prescription is in the lower part of the glasses as well as the telescopes. And they're able to drive by looking through the lower part, and then when they need to see something better down the road, they lower their chin, they look through the telescope, and they see it much better. I've prescribed these for many people, and they can be very helpful. Another variety of telescopic glasses can be used the same way is this type, and this is interesting. The telescope is for one eye only. There are mirrors in this device so that you can get more magnification with this without it having a very large telescope. And it's also focusable by using a little knob here on the front. So once again, you drive through your prescription in the bottom of the glasses. If you want to see something down the road better, you tip your chin down just a little bit, look through the telescope, see what it is, bring your chin back up, and you're driving through the lower part of the glasses. Well, these are just a few of the ways that a low vision optometrist can help someone with Stargardt disease see better so that they can accomplish the tasks that are important to them and lead a more normal, active, independent life. By careful evaluation of the person's vision, the doctor will be able to prescribe what's going to help you function the best. In my low vision practice, I always speak by phone with people with Stargardt disease or other conditions before I schedule a low vision evaluation. I ask a few questions about their remaining vision and about their goals, and then I'm able to tell them whether I'll be able to help. Give me a call for a low vision telephone consultation. There's no charge, no obligation. I'd love to talk with you. Call me at 866-321-2030.